At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family. Greetings and welcome to our latest Let's Talk Your Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS, thank you for joining us. Education is the key to better understanding the health issues affecting our community, and South Texas Health System is committed to helping you prioritize your health. By hosting these monthly Let's Talk Your Health webinars, hopefully we can prevent, manage, and delay serious health issues in the communities we serve. In this installment, we'll be talking about brain bleeds, the second most common type of stroke. A life-threatening medical emergency, a brain bleed can be caused by numerous factors like high blood pressure, brain tumors, an aneurysm, or a traumatic brain injury. Typically occurring when an artery or vein ruptures, a brain bleed jeopardizes the blood vessels that supply the brain with oxygen and nutrients, preventing them from reaching brain tissues and cells, which can lead to serious complications like brain damage, death, or prolonged disability. So to learn more about the dangers of brain bleeds, we're joined by registered nurse Amanda Rubalcado, a stroke educator with the STHS Neurosciences and Stroke Institute. Amanda, thank you so much for joining us.
Yes, thank you for having me.
Now, when we talk about brain bleeds, we always hear about ischemic strokes, and that is really the number one type of stroke that we see. But brain bleeds being number two, it's only 13%, but they're actually more severe and more life-threatening. Is that right?
Yes, depending on the location and how big the bleed is, it could change the outcome entirely, from a patient walking out of the hospital to a patient not being able to go home.
And we talk about strokes and be fast and being the slogan that we use, that acronym of making sure that we notice the symptoms and act right away. It's the same thing with a brain bleed. Time is brain.
Yes, that's correct.
Mm-hmm.
We always want to watch out for those risk factors and try to get educated on how to prevent a stroke from happening in the first place, because prevention is going to be the best kind of key to healthcare, right? We don't want to have a stroke happen right then and there, and then you have to deal with the deficits later on. It's better to just prevent it from happening right to begin with.
Mm-hmm. And when we talk about brain bleeds, age plays a big factor, just like it does with stroke. Most brain bleeds happen in older adults, but you actually have seen them in younger adults, and we're seeing them in more younger adults. Is that right?
Yes, we do get a lot of younger people in the hospital, and it's more concerning. I'm not surprised anymore to see 40-year-olds coming in with stroke symptoms, even 30-year-olds. We've even had some brain bleeds as young as 20 years old that they were not a traumatic cause. So it could happen to anybody. Just need to know the signs.
Mm-hmm. And the one thing about the brain bleed, especially because it can happen at any age, and that's with that traumatic brain injury. So if you're involved in a car accident, you have a concussion while playing football, things like that, that can lead to a brain bleed. Is that right?
That's correct, yes. Traumatic is going to be the most frequent causing of brain bleeds, but our brain bleeds that happen spontaneously are your hemorrhagic strokes.
Mm-hmm. All right, and you have some great education for us. You put together a presentation, so let's get started.
Yeah, sounds good. Okay, so let's see. What are brain bleeds? They can happen through traumatic causes, as we've talked about. Like if you're in a car accident, you're playing sports and you get hit in the head, or you fall and hit your head. Those type of things can cause those traumatic bleeds, of course. The ones I want to focus on are the spontaneous bleeds that can happen very suddenly. most likely due to small vessel disease that happens over time. So these are completely preventable unless you're having like hereditary conditions like AVMs, aneurysms. So let's talk about it. So those type of bleeds are hemorrhagic strokes. It's less common compared to our ischemic strokes, but even our ischemic strokes can turn into a hemorrhagic stroke if it's large enough and it can convert. So we still have to watch out for those brain bleeds even if you're having an ischemic stroke. So it occurs suddenly when the blood vessel in the brain ruptures and leaks into brain tissue, causing that extra pressure onto the brain, causing it to be more swollen and damaged over time. And to put it simply, if we compare our blood vessels to pipes in a home, like plumbing, our ischemic strokes are more like a clogged pipe that's causing those issues. And our hemorrhagic strokes is more of a bursted pipe that causes water damage all around, and we don't want that, right? It can quickly become life-threatening. It's important to know about this condition because early recognition and treatment can significantly improve the outcome. And if you act fast, get them to the hospital as quick as possible, it can be very life-saving and change the functional outcome of that patient. And hopefully by talking about brain bleeds today, we can develop an understanding of the risk factors, the symptoms, and urgency of medical intervention. It can help save lives and reduce long-term impact of brain bleeds. So in the picture here, you can see there's different types of bleeds that can happen. The one at the top is our bursted aneurysm causing a subarachnoid hemorrhage. Our subarachnoid space is in between the meninges and the brain, so it's within those little fissures inside the brain, and sometimes that blood can irritate the brain. And then below it is more of a torn artery causing an intracerebral hemorrhage. This kind of hemorrhage can happen within the brain tissue, and this is more frequently caused by high blood pressure, but weakens those vessels over time. Types and causes of brain bleeds. So there's many different types, like I said, depending on the location. Our intracerebral bleeds are going to be more than likely what we're going to try to talk about and what we can try to prevent. Let's see here. ICH can lead to a significant brain damage. Of course, we have our subarachnoid hemorrhages next. These are more due to like aneurysmal rupture, as you saw in the picture before. They can be very tricky to treat. There is actual like performance measures we do have to watch out for, and there's standards on the care of these type of patients. They are very rare, but they do come, and we take very good care of them in the hospital. We're on top of this. Most of the time, they have to end up staying in the hospital for at least 2 weeks to make sure that they don't have any kind of further deficits. Sometimes those vessels, they'll spasm after having that blood products being broken down, and it really irritates those vessels, unfortunately, and causes the vessels to react and contract, can cause an ischemic stroke, actually. So we usually watch the patient for 2 weeks after that, and we'll put them on medication. We have our subdural hematomas next. Those are more towards the skull of the brain, but still next to the meninges. Those do happen more to our older folks. There can be traumatic causes, but for our older folks, it's mostly because for them, their brain tends to shrink a little bit over time compared to young people where their brain is full and not shrunken and atrophied. So whenever that shrinkage happens, there's veins connecting the brain to the skull, and those they pull on those veins, and they can basically rip and cause that bleed happening. And they can present chronically too. Like, we've had patients that come in, they've been acting weird over the past few months, and sure enough, when we scan the brain, you can see old blood and new blood mixed in. He's been slowly bleeding. So you'd be surprised. Sometimes it's not very sudden. So watch out for those too. Our epidural bleeds are mostly traumatic. They happen with skull fractures, a lot of the times with blunt force traumas. So those are actually very dangerous. They're arterial bleeds, and they need to be seen ASAP. So certain causes, of course, the trauma, like I mentioned. Hypertension is going to be our key risk factor for our hemorrhagic strokes. Aneurysmal ruptures, AVMs, Those are arteriovenous malformations that combine the veins and the arteries together, and it's not good because our veins are not equipped to handle the pressure of arteries, so they can burst and cause a bleed. Blood thinners, anybody on blood thinners like Eliquis, warfarin, Xarelto, those are the more heavier anticoagulants that can cause bleeding, and they tend to cause bigger hematomas that form and more severe deficits. So make sure you know which family member is on blood thinners. You can have patients on antiplatelets like aspirin, Plavix. Those are not considered anticoagulants, but they're thinning the blood a little bit, and those don't tend to cause too big of a bleed. Drug use, the most common one we see is cocaine here in the valley. We call those the cocaine hemorrhagic strokes, and yeah, it tends to spike your blood pressure very high, and your blood vessels cannot take that big spike. Bleeding disorders, some people are born with actual blood clotting issues, but it's more rare. Statistics. So stroke, hemorrhagic stroke, or just stroke entirely, sorry. It's the 5th leading cause of death and the #1 cause of disability in the United States. Every year, 795,000 people die in the United States of a stroke, or have a stroke, not die. Every 40 years, someone in the United States has a stroke. Every 3 minutes and 11 seconds, someone dies of a stroke in the United States. It is a very serious condition that leads to high rates of death and long-term disability. This bleeding disrupts normal brain function and can cause significant damage. So some statistics I did look up for Hidalgo County, like why is our Hispanic population more at risk? Because we tend to have strokes more than the than the white population. Where's my stuff? So some of the demographics, our population, 30% of our adult population has hypertension, which is not good. Diabetes was significantly higher compared to the United States in total. We had a bigger percentage of adults having diabetes. Obesity, 40% of adults, and physical inactivity, 35%. But from what I see in the hospital, a lot of people will tell you that they don't have any medical conditions. They don't go to the doctor. They don't get checked out. So a lot of the time, they don't know that they're diabetic. They don't know that they have high blood pressure. That's why it's really important to get checked out at your physician. Even if you're uninsured, I recommend trying to get those free blood pressure checks and sugar checks. Sometimes they'll do it at HEB. But you never know. It's really important to get checked out. They actually call hypertension the silent killer, and you can go your whole life without knowing you have high blood pressure, and until suddenly one of those blood vessels can burst and cause that issue. And we get patients all the time where they say they don't have any past medical history, but the evidence within the vessels and seeing all the damage done, it's obvious that they've been dealing with high blood pressure for a long time. I looked up some more demographics through our registry on stroke. The median age was actually 65 years of age. We've had a range of 20-year-olds to 98-year-olds having brain bleeds, and our percentage of male and female was 46 female and 54 of male. And the average blood pressure coming in was 168/87, so it was pretty high. And also the most common comorbidities that these patients had was high blood pressure, obesity, and diabetes. Those are what I've seen that was the most common in our whole ICH stroke population, and Get With the Guidelines Stroke Registry for 2024. Okay, so let's go over who is at risk. There's a lot to talk about here. There's going to be two different sides of it. There's risks that we can change, risks we cannot change. Let's start with the cannot change. Of course, if you've already had a brain bleed, the chances of you having another brain bleed is higher than someone that didn't have one. Advanced age, people older than 65 are more higher risk for having a stroke as well. They say from age 40 to 70 is a sharp rise in our ICHs in the lobes of the brain due to cerebral amyloid angiopathy in older adults. Gender, males are more at risk, as you saw, even in our Hispanic population. They had a higher percentage of 54 compared to our female population. Ethnicity, non-white ethnicities are at higher risk. That's your Hispanics, African Americans, Asian Americans. They are more at risk. People with chronic kidney disease is going to be more higher risk. They do tend to have more blood pressure issues over time, and drops and spikes in blood pressure can contribute. Tumors, any kind of brain tumor can lead to bleeding. Family history, bleeding disorders, any genetic predispositions can increase stroke. Anyone that has an aneurysm or an AVM, there's always that risk of rupture and bleeding. Not every aneurysm will rupture though, because a lot of people can live their lives with an aneurysm and they didn't know about it and they were just fine. Another common one that you mostly see in our elderly population is what I said before, the cerebral amyloid angiopathy. We call it CAA, and that causes our hemorrhages that happen in our lobes of the brain, higher up. So those are more noticeable because it's a higher functioning in the lobes. And then you have your modified risk factors. As you know, our most common one, high blood pressure, we have to manage it. If you don't know you have it, get checked out. It is silent. Then you can have maybe headaches that happen that'll kind of indicate that you have it, but you have to check. You won't know you have it until you check. So it does increase the likelihood of having a stroke by 2 to 4 times, leading to a small vessel rupture in the deep inside the brain. So current smokers, smoking has been shown to actually increase the risk of bleeding as well. It really damages inside the vessels. Coagulopathy, it could be due to medications like being on anticoagulants, being on antiplatelets, or it could be acquired like our liver, what's it called? End-stage liver disease, basically. They are more higher risk because they don't have those clotting factors being made by the liver, and they're more prone to bleeding as well. Let's see here. Any diabetes? So diabetes has been shown to damage the blood vessels in the brain over time. It's a weird condition that actually changes the anatomy of the vessels within your brain, making them more likely to rupture. Excessive alcohol intake that I've seen, especially our heavy binge drinkers, you're at higher risk for having a hemorrhagic stroke. Any kind of head trauma, traumatic bleeds are given. Obesity, not everybody thinks about it, but obesity does contribute to the rest of those comorbidities like diabetes and hypertension, high cholesterol. So maintaining a healthy weight will actually reduce your risk of stroke. Let's see here. That's it for that. So knowing what signs and symptoms to look for is going to be key for recognizing a stroke happening right before you. It's really important to know these signs. We go by the acronym called B FAST. B is going to stand for balance. When there's a sudden loss of balance, you're feeling suddenly dizzy, get checked out. That's a sign that you're having a stroke in the back of your head, especially when it's coupled with any kind of other deficit like the rest we're going to go over. Eyes is E, vision loss. Some people come in with transient blindness that it just comes and goes, or blurred vision, and sometimes just one part of your vision that's not being visualized, unfortunately. So we do look for that. It's another sign of one of those posterior strokes. So face, our classic stroke sign is going to be the facial droop, and a severe headache, which will be the worst in their life. They call it the thunderclap headache, and that's the sign of a subarachnoid hemorrhage, actually. Especially when you have like neck stiffness or tenderness, photophobia, where people cannot stand to look in the light, it disrupts them. Arms for A, weakness or numbness in the legs or the arms actually. So usually when I see if it's just happening to one side of the body, that's a huge red flag for a stroke, unfortunately. So you call 911 on that one. Speech for S, slurred speech can happen, but what a lot of people don't know is it's not just the slurring of the speech. It's trouble speaking or trouble understanding language all of a sudden. Like they're trying to tell you something, but the words are coming out all wrong. Maybe they just keep repeating that same word like no. That's a big sign of a stroke. Sometimes people can't even speak at all, and we see them come in completely mute and they can't speak for themselves. So it tends to be really hard to assess them when they come into the ED. So it's really important to have that family member there and always get EMS to help you out. Confusion, it'll kind of appear like confusion too, because they're not understanding you. And they're getting really frustrated most of the time. T for time, you're going to call 911. Our EMS are actually trained to take you to the nearest stroke certified center. There's a few comprehensive stroke centers nearby, but the EMS can actually help you stabilize your vital signs, and they'll help you transport to which center is a stroke certified center. So not every hospital has neurosurgery available or neuroendovascular services available. So it's really important to call 911 if you notice any of these signs. It doesn't have to be all of the signs. Even if it's just one or two, get checked out, especially when it's happening suddenly. So how do we diagnose a brain bleed? We normally get a quick, focused neurological examination. We'll go over BFAST. We also do NIH. We'll try to do it as fast and efficiently as possible and get them to the CT scanner as fast as possible. We'll even have a pre-notification from EMS that'll notify us ahead of time to get them onto the scanner and clear out whoever is using the scanner. So we make it as quick and efficient as possible. We want to see if there is a bleed going on. It won't tell us if there's an ischemic stroke, but this is going to be the most quick and efficient way to see if there's bleeding in the brain. It'll appear denser. If you can see number A or letter A, it'll appear like very white looking compared to the rest of the brain, and that's the blood. It's not supposed to be there. CT angiogram provides detailed images of blood vessels and helps identify the source of bleeding and any vascular abnormalities, but it requires the use of contrast, so there are some challenges there. Some people have allergies to contrast, but we can give medications to try to help alleviate those allergies ahead of time. So it's good to know and let your providers know that you have allergies to iodine. MRI of the brain with or without contrast. So our MRIs are able to provide us with a more clear picture, and it could show us how the bleeding evolves over time and is better at detecting any underlying problems like tumors or hidden smaller blood vessel issues going on. Unfortunately, it does take longer to complete, and some people may have claustrophobia inside the MRI scanner, since it does take like about 20 to 30 minutes to complete sometimes, depending on how much we're doing too. Blood tests we can do. We do check to see if they're on an anticoagulant. Sometimes maybe their blood levels got too thinned out, so we do check that. If they're having clotting disorders, we'll do a whole hypercoagulable panel on those patients that we're suspecting clotting disorders on. Especially like if that patient has histories of DVTs, pulmonary embolisms, basically blood clots in the body, and even miscarriages. It's going to be a sign that there is a hypercoagulable disorder going on. So what do we do for these brain bleeds? Of course, call a code stroke when they come in. We want to get everyone available as soon as possible, get them to the CT scanner. The main thing is we are aiming to prevent the hematoma from expanding and causing excess damage. So those 24 hours are very critical for our brain bleeds. We try to control the blood pressure to a more acceptable range. So a lot of the times our brain bleeds do come in with very high blood pressures, way above 160 for our systolic. So we'll lower it with the IV medication and try to get it under control within the hour actually. but we don't want to drop it too low because that actually causes more damage. Hematological therapy, we need to know, is this patient on an anticoagulant? Because do we need to reverse that anticoagulant? And we need to know when the last dose of that anticoagulant was. So that way we know what kind of therapies we can do to try to reverse the effects of the anticoagulant, especially if it was just taken that morning. Sometimes patients get scared and they'll notice those signs and symptoms and they'll be like, oh no, and they'll take an anticoagulant, and we don't want them doing that. We want them to get seen as soon as possible because they don't know right then and there that their symptoms might be from a bleed instead of an ischemic stroke, and they're making the problem worse. We need to evaluate them for surgical neurosurgery as well. So the the therapies for brain bleeds is actually evolving currently, where there was just new guidelines that came out for ICHs, and we're trying to monitor like how quick we should do blood pressure management, what levels, what kind of surgeries are effective for this type of bleed, because sometimes craniotomies, maybe, yes, it keeps them alive, but they still have very disabling deficits afterwards. So you really have to weigh in what that patient would have wanted later on, because maybe they didn't want to live with a feeding tube or a tracheostomy or be bedbound. So you talk to your loved ones and try to determine like what kind of lifestyle are they willing to accept, because these brain bleeds can be very devastating most of the time. Any blood thinners, as I said before, warfarin, Coumadin, Eliquis, Apixaban, Xarelto, Rivaroxaban, Pradaxa. So those are some of the anticoagulants. Prevention tips. So how do we prevent it from happening to begin with? Because that's going to be the best thing you can do, is prevent it from happening to begin with. Controlling blood pressure, you're going to manage your diet. Less sodium, that's for sure. Less greasy, fatty foods. It's really important to try to know what you're eating too, instead of eating out so much or fast food. I know life is very fast paced and it's very easy to just get fast food. But if you're planning to make at-home meals, know what you're getting. Read those nutrition facts labels. There's a really cool way of reading them. I know I wasn't reading them back in the day. So make sure you know which servings are contained in that container. So this one says 1 slice. So 1 slice out of the 6 is just 420 calories. So knowing how to read these can make your life a lot easier. The gray is what we want to avoid. We don't want a bunch of saturated fats. We don't want a bunch of cholesterol. And definitely the reds are going to hurt us. Trans fats are not good. Sodium, especially at 41% of your daily value, that's a lot of sodium. You don't want to be eating 1 or 2 slices of this. The greens we do want. Dietary fiber is good for you. Fiber helps actually lower your blood pressure and lower your cholesterol. And stay away from those added sugars. You'd be surprised how much added sugar they put into stuff, so be careful of this one. I try to stay away from this as much as possible. And focus on your protein intake. A lot of people do not get their required protein amount in a day. So aim to get enough protein for your weight. And then below the black line, you'll see some of the vitamins and minerals that you'll get. Make sure you know what you're getting. It's really important to get those vitamins and minerals, because that's what helps keep us going and keeps disease processes from happening in the first place. If we don't watch this, then we're going to become nutrient deficit. If we're just eating a bunch of carbs, a bunch of sodium, a bunch of fats, it's not good. And of course, our blood pressure management, there's different categories too. I know for me, I'm probably elevated, but it's with some diet and exercise, you can bring it down. It's not going to just get worse from there. It's definitely possible to go back to your normal. High blood pressure is from 130 of your systolic to 139, or your diastolic of 80 to 89. High blood pressure, if stage 2 is 140 or higher, 90 or higher for diastolic. And then you have your hypertensive crisis. This is when we need to start maybe getting to the hospital to try to get that blood pressure down, because it's too high. higher than 180 or higher than 120 for our diastolic. It's really important to quit smoking. If you are a smoker, it will help decrease the risk of stroke by at least twofold. Avoid recreational drugs. I know some of the common ones down here are cocaine, amphetamines. Those drugs will spike your blood pressure way more than it should, that your blood vessels can even handle. So try to stay away from those, especially with alcohol. Just try to keep it at a mild to moderate intake. You don't want to do that binge drinking. It's bad for you. Regular medical checkups. Go to your doctor, get checked out. They will help you manage those risk factors. And taking your medication as prescribed. Even if you're having side effects, let your doctor know. Maybe that medication can be changed to a different medication or the dose be lowered. So try to communicate with your doctor. That way you can work on getting these risk factors under control before it gets out of hand. We do have stroke certified facilities. For STHS in general, most of our facilities are stroke certified. All of our freestandings, except for we haven't been surveyed yet, will be able to take care of a stroke patient. We are able to give the emergent clot buster medication for our ischemic strokes. And then we're able to do basic imaging like CT heads, sometimes advanced imaging like the CT angios. But then they're not for admitting. They'll transfer to one of our main hospitals. Most of the time they'll go to our comprehensive site, STHS McAllen. We are certified by DNV. It is the highest level of stroke care that is possible. So there is 24/7 access to advanced imaging services. That way we can see the vessels, even DSAs. We do have a AI software to help us detect if there is a clot that's causing the issue. We have neurovascular services 24/7 and neurosurgical services 24/7. We also have a dedicated stroke unit at our McAllen site, and there is an upcoming neuro ICU that is projected to be open in the end of 2025. And then we have our Edinburgh and Heart Hospital sites. These are primary stroke centers where we're able to do thrombolytic therapy, basic stroke care, and admit those patients and keep them there if they're not a candidate for neuroendovascular services. But if they do end up needing those services like neurosurgery or neuroendovascular intervention, they're going to be transferred to our McAllen site. Okay, so early recognition saves lives. Know the signs and be fast. Thank you very much. References.
No, that's great. It's really important information, especially since this is Stroke Awareness Month, and
Yes.
making sure that we're raising awareness throughout our communities. I know that we've had proclamation signings in Mission, in Wesco, and in Edinburgh, and it's really important to make sure that the community understands, because stroke is the leading cause of disability in the U.S.
Yes, it is.
Now, when it comes to brain bleeds, there's about 60 to 70,000 cases a year in the U.S. alone. And the burden, though, is increasing. We're starting to see a prevalence of those cases. It's increased 43% in new cases since 1990, and it's 37% increase in deaths since 1990. So we are starting to see those deaths. There are those high mortality rates we really need to know about.
Yes, correct.
And then let's talk a little bit about the risk factors, as you talked about. So obviously age, we talked about age being a serious risk factor for brain bleeds, but it is the most, it's more common in older adults, but as you mentioned, you're starting to see it in younger adults. So really paying attention.
Yes.
Now, when it comes to gender, men are more likely to be affected than women.
Yes.
So needing to understand that as well. And then our race, you talked about Hispanics can be a little bit more susceptible. Hypertension, which we've talked about hypertension is the number one thing that you can control.
Yes.
That will help prevent stroke, help prevent a brain bleed or an ischemic stroke.
Yes, that's correct. Hypertension is the silent killer, so get it under control.
Mm-hmm. And how often should you be reading your blood pressure? Like getting a reading for it. I know that they sell the machines that you can do it at home and just get a quick reading.
Mm-hmm. Yeah, so even at HEB, Walmart, they sell blood pressure devices. They are only like $20 to $30. So it's really handy to just have one on hand, especially when you're having a headache. I know I check mine at least once a week. My blood pressure isn't too bad. Some people that do have high blood pressure may need to check it more often, at least every day, maybe 3 times a week if you have it under control, more or less, and you're on blood pressure medications. But I always recommend to just check that blood pressure first thing in the morning before taking your medications. That way, like maybe you changed your diet and your blood pressure is reading lower than normal. So it's good to know what you're at and what your trend is beforehand.
Mm-hmm. All right, let's talk about the causes of a brain hemorrhage or a brain bleed. So, the most common cause of brain bleeds in younger adults, those younger than 50, is head trauma. So, head trauma is something that we really need to be paying attention to. And I know we talk about safety all the time and wearing our seatbelts in vehicles. We hear a lot of accidents, especially we don't have the construction as much as we did in the valley, but there's still accidents that are happening on our highways and our roads.
Yes, like any kind of like contact sports too, like with football, it's more higher risk than most sports. So I don't know. It always makes me nervous seeing those football games.
Because you never know when one wrong hit is going
Yes.
to be, and that's why it's always really important to be wearing your helmet when you're riding your bike, when you're playing any of those
Yes.
rough sports that may cause an injury.
Yes, and driving safely. Don't be distracted when you're driving, especially texting. It can wait, or just have your phone connected to the car and just talk to it. It has that capability most of the time.
I think I was reading some statistics, and one of the statistics is distracted driving is like basically driving blind for 100 yards, which is basically the length of a football field. Looking down for 1 second that's the equivalent of about 100 yards. So it's really dangerous. Let's talk about high blood pressure again. Is one of those major risk factors. It's something that's very controllable if you're able to take your medications and take them as prescribed. I know people get a little lax when it comes to their medications. They're like, oh, I've been feeling well, I don't need it. But the reason it's prescribed is so that it should be daily, and that's why it's to keep you level.
Yes, consistency is key, and just monitor those trends.
Now, an aneurysm is another cause. And so how often do you see aneurysms, and are we seeing them at young ages?
Yes, we do see them at young ages. The youngest I've seen, it was a 20-year-old just last year, but it's hereditary sometimes, but they can also be due to spikes in blood pressure. So any kind of spike can cause a weakness or a ballooning of those blood vessels, especially at the bifurcations. So it's important to not do any risky activity like drugs.
And then you talked about liver disease. So having liver disease puts you at greater risk for having a brain bleed.
Yes, liver disease, like, you don't make those clotting factors as you usually do, so your blood is thinned out. Even if you are not on an anticoagulant or a blood thinner, you will bleed quicker and faster than most people. So you have to be very careful when you have liver disorder.
And to remind people in terms of who is at risk, so you have high blood pressure, which we've talked about. You have a substance use disorder, so illicit drugs may impact your vessels. The use of tobacco, and I know smoking, we talk about it all the time, how you should just not smoke. Smoking is a key risk factor.
Yes, it is. We try to make sure that we counsel every patient that comes in that is a smoker to try to quit. And we'll try to help them out with medications. There's medications that can be prescribed to help try to curb those cravings. So, or over-the-counter medications like the nicotine patch or just nicotine gum. So, whatever way, everything works different for everyone. So.
And then obviously you injure your head, which we've talked about the importance of helmets and making sure you're protecting at all times. And then a brain tumor, having a brain tumor?
Yes. I mean, there will be some signs of a brain tumor if you're like having a lot of dizziness and balance issues. It just depends on where the tumor is forming too. Sometimes even seizures can precipitate brain tumors and vision loss. So just know your signs. That's why it's important to be fast.
And speaking of the symptoms, the Be Fast, I know that you guys have magnets that you give out at community events that you can put on the refrigerator that just has the Be Fast, just as a reminder. And I know you also do a lot of education with younger generations. And so teaching your kids is also really important, especially if you have a household where you have a grandparent in the home, or your parents are a little older, making sure that children also understand the symptoms and signs.
Yeah, we've had cases where it's been the kids that call 911 for the parents. So it's really important to even have kids educated on the signs and symptoms of a stroke. They can save their loved one's life.
And then Be Fast. So those symptoms, and there's some that you can also remember. And so a sudden severe headache. So that may be a telltale sign that there's something seriously wrong.
Especially if it's like the worst headache of your life, get it checked out. It's not normal to just have a sudden headache like that, especially if you're in the midst of activity like gardening and you're like bending over. Some people can feel that pop and it just severe headache afterwards. So
sensitivity to light. So you just it's too bright and you can't really focus or concentrate.
Yeah, so photophobia, we don't want to look at the light. It hurts them literally. Like there's other people that do have some neck discomfort when they come in with those kind of bleeds too. So any problems flexing your neck like this and it's hurting you, that's not normal. So.
All right, seizures with no previous history of seizures. So if you've never had seizures before and all of a sudden you have a seizure, that's a sign to watch out for. Weakness in the arm or leg, which we talked about, that's the A and Be Fast. So making sure that you're paying attention. And I understand that it's typical on one side, as you mentioned, but is it predominantly on your predominant side more often than not? Like, so if you're right-handed, it'll affect your right, or is it?
So depending on the area of the brain. So if you have a infarct happening on the right side of the brain, it'll cross over to the left side. So you're having deficits on the left side. So when you come in, we know to look at the right side of the brain.
All right, and then decreased alertness, or decreased alertness. So you're not able to concentrate. You can't really pay attention to anything.
Yeah, especially if someone's trying to wake you up and they just keep falling back asleep. That's called lethargy. It's not normal.
Yeah.
You got to get that person checked out.
And then changes in vision, so double vision, like you're having vision problems, you're just not really able to see clearly.
Yes.
A drooping eyelid. So I know we talk about face a lot, and sometimes you see the mouth sort of like drop a little bit, but eyelid as well.
Yes. Sometimes it can affect the whole face. Sometimes it's just Bell's palsy, but you should still get checked out. A lot of the times we'll ask people to smile, and you can really see how much of a difference it'll be. You can see the asymmetry, and ask them to squeeze their eyes. If they're not able to squeeze that one eye, then it's another sign.
Stiff neck, which we talked about, trouble breathing, and then tingling or numbness is another thing.
Yes.
Trouble swallowing is another sign. Difficulty writing or reading. So that's something like if you're not able to write, and I've seen that in like a movie where someone's like writing something and then they sort of faint. So
yes, I mean, it all just depends on that area of the brain that's being affected. You can have someone doing everything right, but then you ask them to describe a picture for you and they can't do that. That comprehension is just not there. It's really weird.
And then feeling dizzy, the loss of balance, which was the B, and then an abnormal sense of taste.
Yeah. I haven't seen it too much. We don't really test that right away.
Yeah. And then loss of consciousness, obviously
Yes.
passing out, is definitely a sign to call 911. And the complications with the brain bleed, we always talk about swift action being so important. So some of the issues, so you may start experiencing seizures from that down the road, cognitive impairments, motor deficits, communication difficulties, and psychological challenges.
Yes.
So post brain bleed, how closely do you monitor a patient after, and like how often does a doctor do they have to then go and see them every 3 months, every 6 months? It really just depends on the case, I am assuming, but it's something where you're going to see them more often.
Yes, it's really important to follow up even after having a seizure. I know you don't want to see the doctor after that, but it's really important, especially if you had seizures during that time and you got put on anticonvulsant medications. You need to follow up with your physician to see if you need to keep taking it or what medications you should be taking. So make sure you follow up. It's really important.
All right. Are there stages of brain bleed recovery? Like you hear like the acute, which means it's happening now. It's this moment, right?
Yes, sometimes in the acute phase, we do try to have that brain rest and try not to disturb too much. We don't want to push them to get out of bed right away, but we still try to work with them within the bed. Within the 3-month period, we do try to make sure that they go to therapy and get evaluated for rehab. They need to be checked out by a therapist and get assessed for that. So there is something called neuroplasticity where we're able to try to regenerate those neurons to connect again and try to work around the area that was damaged. And it is possible to try to reconnect what you've lost. You just have to work on it and always have that repetition, because repetition is going to rebuild all those connections.
And then recovery time. People probably always ask you, how long is it going to take me to get better and to be back to normal? And that really will depend on the severity of the brain bleed.
Yes, depending on how large the brain bleed was. Everyone has different deficits, different outcomes, but just depending on how that patient is, it can be months, 2 years. It really depends on how hard you work to recover too. Those 3 months are what I say critical. Like you have to work at it those 3 months afterwards as much as you can, because that's when our brain is most likely to make those changes.
All right. Now, when it comes to recovering from a brain bleed, it's important to follow the medical advice and really adhering to what your healthcare provider's instructions have been, including medication schedules and therapy sessions.
Correct.
You have to do what you're told. And I know sometimes you think, no, I don't need it anymore. I'm having a good day, but you have to adhere to their instructions.
Sometimes you have to be pushed to take that extra step, because your body will, your mind will tell you no, and you need to get pushed sometimes. And that's what our job is to push them to get better.
And then there's obviously rehabilitation treatment, and there's the 3 types. So people may not be aware. They think, oh, physical therapy. So obviously physical therapy is really important, because especially if your motor skills are affected, really kind of getting you back to walking again and all of that.
Yes, not just physical therapy, but occupational therapy to work on those fine motor skills, like being able to do buttons, to brush your hair again, just working on those fine motor skills. And then there's speech therapy. Some people need some help trying to remember how to speak again, doing exercises like those, even swallowing. Sometimes we need that extra exercise to try to get those muscles working again.
I think people tend to confuse occupational therapy with a work, like you had an injury at your workplace, and so you go and you get occupational therapy, but it's not. Occupations are your daily, your activities of daily living.
Exactly.
So your ADLs, if I'm correct.
Correct. Yes.
And so those really are your occupations. You're brushing your teeth, tying your shoes. I know that at STHS Edinburgh and McAllen, they have in the inpatient and outpatient sections, they do have like mini kitchens set up, so that you're able to even just having to cook again and use the stove and turn knobs and turn on a microwave, open a refrigerator. Those are all those occupations that you need to get back.
Exactly.
A healthy lifestyle. We cannot stress this enough.
Yes. it is hard, but you have to make the time for it. I know I need to.
So balanced diet, which you talked about, and I really appreciated you going through the label and really going through, these are the good, these are the bad, and these are the completely avoid.
Yeah, let's avoid it. Those added sugars are terrible.
And then getting, obviously, plenty of physical exercise. So even if you've experienced a brain bleed or a stroke, exercise is still good for you. It's important to get the body moving.
Yes, it doesn't even have to be like strenuous exercise. You can just take it as easy as going on a walk for 30 minutes, even less sometimes. If you want to start out slower, just go on a walk for a little bit and start there, and then try to increase that time further and further.
Baby steps. So starting, and you should hopefully get up to getting 150 minutes of moderate intense aerobic exercise a week. So not a day. You don't have to go that hard, but if you want to, unless you want to, but 150 minutes a week, which breaks down to 30 minutes a day, which is not that bad.
Yes.
And get adequate sleep. I don't think we sleep enough, and the brain especially needs time to rest after a long day.
Yeah, you'd be surprised. Like, even sleep has been helping with weight loss. Like, if you don't get enough sleep, you're not going to lose that weight. If you do get enough sleep, you get that extra time to rebuild those neurons and rebuild your muscles. So like everything needs that time to recover. So sleep is way more important than you think.
And then lastly, emotional support. It's really important to have a support network around you.
Yes, we do have the stroke survivor group as well. I know for STHS, we have it every month. So even after experiencing a stroke, it's really important, even for the caregivers, to get that extra support, because they should be screened for depression and anxiety afterwards, because they're higher risk for developing those issues after a stroke.
And now we talk about the importance of calling 911. And I know that there may be a take me to the ER right away situation where you notice your loved one is having a brain bleed or a stroke, and you want them to take you right away. But the difference with calling 911 is that they're able to go to your house, they're able to connect with the hospital right away, right? They collaborate with you all.
Give us that pre-notification before they even get there to see if we're available to have that intervention. You need to know like where you're going beforehand. It's going to cause a big delay if you end up going to a hospital that your family brings you to and they don't have those capabilities. So we rely on EMS for that. And
going to the nearest ER is also crucial. I know that we talk about all the different hospitals that you can go to and all, but just getting to an ER. So even the freestanding ERs that STHS has, they're acute stroke ready minus FAR, because they haven't had the survey just yet. But those facilities are able to help you, treat you. And I know that we've recognized some of the staff from Montecristo and a few of the other locations for doing the thrombolytic treatment within record time, which helps, with those strokes.
Yes. Even just right now, I just got a notification that we've been doing really good with our door-to-needle time. We got one at like 16 minutes just a little bit ago. So get seen as soon as possible. It's life-saving interventions.
So what is your final key takeaway, your piece of advice for those watching?
Oh gosh, control your risk factors. You want to prevent a stroke before a stroke happens. Hypertension is a silent killer. You need to control it and make sure you even know if you have it. If you don't even feel it going on, you need to check. It's better to check and get ahead of it before it gets out of hand. Diabetes, try to control your sugars. We get a lot of diabetics having strokes. The sugar really, it destroys those inside of your vessels and can create a lot of weakening within your vessel walls and can cause the bleeding to begin with. So that and high cholesterol, sometimes the plaque will build up in the arteries and can cause blood flow to be blocked. So high cholesterol is a big one too. And obesity, of course, we want to control that. It is one of the main risk factors here in the Valley. So let's try to control the weight.
All right. Well, thank you so much, Amanda. We really appreciate your time. And thank you for making sure that we know how to be fast,
Yes.
especially Stroke Awareness Month and beyond.
Yes.
All right. Well, that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize your health and the health of your loved ones. We hope to see you for our next installment of this Let's Talk Your Health series on Tuesday, June 17th from 5:30 to 6:30 p.m. when we discuss migraines. Like and follow the South Texas Health System Facebook page for more details on our future Let's Talk webinars. And if you'd like to see our previous Let's Talk seminars, all you have to do is visit sdhsletstalk.com. Until our next seminar, stay healthy, stay safe, and please prioritize your health. At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first Level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family.